let's say we have a bronchiole that splits into two individual alveoli. And each one of these alveoli have a blood vessel that sort of runs over it, like so. And this one's going to have one over here, like so. And then they'll combine for ease of use. Right? As the blood runs over it, it's going to have deoxygenated blood, and then essentially it is going to pick up oxygen and become oxygenated. Same thing is going to happen over here, where we're going to have our deoxygenated blood. As it runs over top of the alveoli, it will pick up oxygen and become oxygenated, which is good, right? What happens if that one of those alveoli in our sort of system here doesn't become ventilated, like so, right? And so if we look at the blood vessels, they're going to run over top of them again and do the same thing. Like so. We have one over here that as it comes through, it will get oxygenated and become oxygenated. This one over here, there's no oxygen inside of this alveoli, so it will continue to pass through and it will be unoxygenated. So what that will cause is the surrounding tissue, the partial pressure of the oxygen in the surrounding tissues to decrease. So what that causes is for the blood vessel that is sort of surrounding that underventilated or non-ventilated alveolus to vasoconstrict. So what we end up with is we have our blood vessel over here, and then we have our blood vessel over here, but it is really constricted. Right? So it's going to limit the amount of blood flow through it. So we'll have blood flow through here, and it's going to pick up its oxygen, but we have very limited blood flow through here. Right? And so when it comes back together, we have mostly oxygenated blood. So what this does is it ensures that the blood is being diverted into capillaries that are communicating or perfusing the alveoli that become ventilated. So your perfusion, blood flow through the capillaries, goes to the alveoli that is being ventilated. So this prevents under oxygenation of the blood in the capillaries where there's no ventilation happening and the partial pressures are low. So that's sort of an intrinsic mechanism to ensure that we're sending the blood to the alveoli that are actually being ventilated, and we're not wasting sending blood to alveoli that are not going to be participating in gas exchange. And that's known as perfusion ventilation coupling.